Okay, so we're moving to the next drug issue which we'll be discussing, and this is poisoning. So we'll talk about the atropine poisoning. The atropine poisoning. So atropine poisoning is also known as what? Organophosphate poisoning. So organophosphate is basically, all those things are used to kill all those insects, and of course they die from the toxicity. But what if it happens to the human? That's the issue we're trying to look at. So usually occurs when someone is exposed to excessive amount of atropine, which is a drug that usually blocks the actions of the parasympathetic nervous system. So the parasympathetic nervous system is a nervous system that actually deals with calming you down, cooling you down, all of that. So when you're overdosed on it, usually maybe ingestion of plants that contain atropine, or sometimes any medication that control atropine, you have issues. So atropine is an anticholinergic agent. So it prevents acetylcholine from binding to muscarinic receptors. Now it will now lead to overstimulation of the sympathetic system and suppression of the parasympathetic activity. Okay, so clinical features is mnemonics often uses what? Dry as a bone, blind as a bat, red as a beet, mad as a hater, hot as a hare. So there's dry mouth and decreased sweating, dilated pupils, flushed skin due to vasodilation, hyperthermia, tachycardia and palpitations, urinary retention and constipation, neurological effects like agitation, confusion, hallucination, delirium, and seizures in some severe cases. So you diagnose it based on clinical presentation, history of exposure, and can also be confirmed with toxicology screening. So you manage it by trying to actually cool the person's temperatures, intravenous fluid, injections, then activated charcoal if they digested it so that they can be able to vomit it out. So a specific antidote is what? The physostigmine, which is a reverse cholinesterase inhibitor. It will decrease acetylcholine levels and counter the effect that acetylcholine could have actually had on your system.